The AIDS pandemic has unfortunately been feminized, and there are now more women than men who are HIV positive. And the inequities that exist, the sexual violence against particularly young women, and the various other issues involving women have been indeed a real tragedy.
I think the most important thing that should happen is whatever goes forward in terms of whatever legislation or funding, you have to also look at it with a gender lens. And so, for example, I don't mean to pick apart ABCs in any kind of political way whatsoever, but insofar as women are not in control, many women are not in control over who they have sex with and under what circumstances, abstinence doesn't work for them. So I just really think it's important that for every single bit of policy that we put out there, that you also view it with an evidence-based gender lens. That you cannot work on issues related to AIDS and women without human rights. I mean, that's part of the problem.
We have to acknowledge and recognize that the AIDS pandemic, women are at the epicenter of the AIDS pandemic, and some of the status inequities as well as issues surrounding women's daily lives have to be addressed if we're going to effectively address HIV and AIDS.
I've always been interested in women's issues because I am a woman, and I've always thought that we weren't treated as equally as men. And when I started doing HIV work, I saw where this was manifesting itself in women getting sick and in women dying. And I think it's just part of this global issue related to HIV infection, which is people who are living in a state of stigma and discrimination and being second-class citizens. People who live in those conditions are at risk for disease, and especially HIV infection now.
We need to bring together HIV/AIDS, sexual reproductive health, maternal health, and obviously on the SRH, access to family planning. These should all be closely integrated together. And about a year ago, the ministers of health in Africa voted that SRH, maternal health, and HIV/AIDS should be integrated together. We should be in our various clinics promoting HIV testing, offering family planning, preventing infection,